what can help a care business to really thrive?
Well, it's really important to understand the environment that you're selling into, because as much as you're a care business, no business can exist without sales. So you've got to understand what your market looks like. We do work with a number of different businesses where quite often people come to us and say, well, we're going to start a business here. And you say, why? Well, this is where I live. But that in itself, although there's a very high demand for care just about everywhere in the country, you really need to understand what the need is in the area that you're thinking of starting in. So you need to understand. In the documentation that you'll get, you'll see that I make reference to the Joint Strategic Needs Assessment, for example, which is a shared document across health and care, which will identify needs in your local area. You also can speak to commissioners in your local environment. So your commissioners for elderly care or children's services, wherever your specialism is going to lie, speak to them. Unless they've got an open tender, they can talk to you. And they are wanting to encourage more providers, so they'll be willing to talk to you as well. So I think that's really important. Get a bit of an understanding, a bit more than just, oh, I've worked in this area, I know this area. Try and understand what sort of contracts are available, what opportunities are available, and what value they have. And also, when you're talking about value, that's when you have to say, well, you know, it can look like I've seen tenders or opportunities where you go, wow, this is worth £250,000 a year, but it could cost you £260,000 a year to deliver it. So you need to really think about how much is your business costing, what are your overheads, and what's your break-even point, and at what point are you actually making a profit? Because if you don't make a profit, your business will not succeed. As much as you love the people that you're looking after, as much as you are caring about the service that you're providing, that's not going to be enough to keep your business going. If you're not quite profitable, but you're almost there, why are you not quite profitable? Is it because it's a new business and you've sunk a lot of upfront costs? Well, that's fairly reasonable, and you'll pull into profitability fairly quickly. However, in the care industry, quite often you rely heavily on council contracts, which in themselves only allow for a very small margin. So it's always worth exploring how you can expand your private clientele base. So how can you approach that? And what's your public facing looking like? So I have spoken to somebody in the past who was saying, well, we're providing residential full-time support for complex needs, but it wasn't on their website. So make sure that your marketing actually reflects what you're doing, and don't rely on other marketing platforms alone. So don't rely on some marketing platforms that will say, well, compare different providers in your area, for example. You need your own website. You need to make it clear that you've got a good CQC report, and you need to clearly outline what services you offer. And try and build up that private client base, because private clients are willing to pay more. You can have a more profitable service. You can take more time with private clients because they're prepared to pay for it, which the council aren't, which can, when blended in with your working day, can actually mean that people get a little bit of a respite and have a more relaxed call when they're in with some of their private clients, although they can be more demanding because they're paying for it. We all know that. But I think that's one of the things. But always be prepared to go back and negotiate with the council as well. If you cannot provide the service that they need at the money that they're giving, then they need a service. So rather than waiting until you go pop and say, actually, this is just too much, we can't manage this anymore, we're going to have to hand back the contract, go back to the council first and see if you can renegotiate and see if there's any more remaining budget, or can we offer an additional extra service at a premium that will actually bring our profit margins up, for example. So all of those different things that you could look at.